Hi, I'm Laura, one of the owners and treatment coordinator at Dental Smiles Flagstaff, and this is Dr. Katie Sharp, one of the co-owners as well. Now, this video is designed to help you understand cracks in teeth, how you get them, what they are, and what you can do about them. So over to you, Katie.
Okay, so what is a crack? A crack is exactly that. It's a crack in the tooth. It can be a little crack that goes off the side of the tooth, or it can be a deep crack that runs down through the tooth, through the nerve, through the root. And depending on the extent of the crack, depends upon the damage to the teeth. Why do cracks happen? Generally, you're either putting too much force on a tooth, so you might be someone who is clenching or grinding your teeth, or that you have a weak tooth. Now, a natural tooth itself is quite strong, but if you have a wide or a deep filling, especially an amalgam filling that doesn't bond to the tooth at all, you are a lot higher risk of that tooth being structurally compromised and a crack working on the side of the tooth or down into the tooth. So what can happen if you have a crack? So some people will present because they have had sensitivity or pain on biting. Other times you might notice that part or the corner of your tooth comes away, and in a worst case scenario you can have severe pain around the tooth because the crack has gone all the way through the nerve and down the root of the teeth. What can we do about them? So it's first of all trying to make sure they don't happen in the first place, so recognising those high risk patients. Secondly, it's assessing what type of crack is. So is it an oblique crack running along the side of the tooth, or is it a vertical crack running down? Sometimes it's difficult to tell you exactly what treatments you're going to need until the crack has been investigated. So I mean under numbness, looking where the crack goes, removing an old filling, and then we need to remove as much of the crack as we can. Sometimes we can do it completely, sometimes it can be done partially. And then depending on how strong the tooth is afterwards, we're either restoring the tooth with a direct, so like placing it in your mouth, composite tooth coloured filling, if it's just a small defect, or if it's a larger defect, we need to try and hold that crack together. So we use a porcelain restoration to sort of as a compression to hold that crack together.
Fantastic, thank you very much.